Today we would know something about the diabetes-related eye problems. As we all know, diabetes is growing as a pandemic. Every 1 in 5 people are diabetic. So the diabetic-related eye problems are also there. So diabetes is not a disease that only affects the body. It is a multi-organ disease. It affects both the microvasculature as well as the microvasculature. Now, eye comes under the microvasculature, like the kidneys, and the macrovasculature are all your peripheral nervous systems as well as the heart. So what happens to a patient having a prolonged period of diabetes? What are the changes that you see in the eye? Now, first of all, when diabetes is a disease, when it affects the eye, the person does not know that the eyes are affected because your vision may be perfectly normal. So how does a patient know that the patient has some amount of changes due to diabetes, which is known as diabetic retinopathy? The person as by himself may not know that he has any diabetes related complication. Only when he comes to an ophthalmologist and there is a dilated fundus examination, then only the ophthalmologist would come to know about the diabetic related changes that are there in the retina, that is known as diabetic retinopathy. It is not only that the diabetes affects the retina, right from the lids to the retina, all the structures of the eye are affected in diabetes. For example, in the lids, you might have the lid related problems like recurrent callosians. You might have the lid related problems like chronic mebomytis, the ulcers in the lids. You can have due to decreased corneal sensation, there might be recurrent corneal erosions. You might get corneal ulcer, non-healing corneal ulcers. Glaucoma is also very prevalent in diabetic patients. The patient gets early cataract due to prolonged period of diabetes or due to uncontrolled diabetes. Then comes the retina, which is much talked about, and the affection in the retina is known as diabetic retinopathy. Now, the patient might lose vision because of diabetic retinopathy related macular edema or diabetic retinopathy complications like vitreous hemorrhage and traction of the retina or the macular area, leading to chronic macular tractional retinal detachment, or as it is a tractional retinal detachment involving the macula. So what happens in macular edema? Now what happens, this microvasculature, they lose the pericytes. There's a layer in the vessels that is known as the basement membrane along with the pericytes. When there is a loss of pericytes in case of chronic diabetes, this leads to outpouching of these blood vessels, which are known as microaneurysms. Now, as there is already loss of these pericytes, these vessels might leak. So this leads to macular edema. When there is leakage of fluid, the fluid content of the blood into the retina. So that leads to macular edema, which causes loss of vision. Due to irregularities in this basement membrane layer, it might lead to small clot formation in the blood vessels, which leads to closure of these blood vessels. What does this closure lead to? Now, as there is closure of the blood vessels, the flow of the blood vessels is stopped. So there is macular ischemia, or there is peripheral retinal ischemias. Now these ischemias would lead to new vessel formation and release of VEGF factors, that is vascular endothelial growth factors. Now these are the cause of new vessel formation in the retina. Now what happens in macular edema, if you come back to macular edema? So once there is macular edema, there is fluid accumulation in the center of the fovea. That is the part of the eye that is required much for your visual acuity. Now once there is fluid accumulation in the central part, this leads to reduced vision. What happens in the peripheral part? In peripheral parts, due to closure of the blood vessels, there is release of VEGF factors, which leads to new vessel formation. Now once there is a new vessels, these new vessels are very fragile. So what happens in these new vessels if they are fragile? They would either lead to vitreous hemorrhage with the movement of the eye, or they might lead to tractions. Chronic new vessels would give rise to fibrous proliferation and lead to traction, leading to retinal detachment or threaten the macula. So all of these leads to decreased vision. Now, if there is decreased vision, are there any treatment available? Of course, yes, there are treatment available, but one should be very clear that the amount of vision one had before the treatment the patient may not get back the similar amount of vision after treatment, because there is constant closure of these blood vessels with the prolongation of the disease and with the uncontrolled diabetes. So what are the treatments that are available? If the center is involved in a macular edema, we have a lot of anti-VEGFs now, like the trade name of Avastin, bevacizumab, ranibizumab or Eylea. And there are lasers also available for macular edema, which is not central involving. And for those which has a vitreous hemorrhage, again you can subside the vitreous hemorrhage with anti-VEGF drugs and then give a laser. Now, laser can be like, it can give a pan-retinal photocoagulation and treat the peripheral part of the retina, which reduces the VEGF load, and thus the new vessels, they regress. Or in cases of in an advanced case of diabetic retinopathy where there is traction in the macular area or there is a retinal detachment, you can go in for vitreoretinal surgeries, and then you can restore some amount of your vision that is lost. Now, one should always remember that it is not only the diabetes. Of course, the primary aim is to keep your blood sugars under control, but it is not only the blood sugar that should be taken care of. Along with this, the blood pressure, the cholesterol, the anemia that is low in hemoglobin, all this should actually go side by side. Along with your blood sugar, one should keep all these systemic factors under control. Now, one should always remember that if you are a type 1 diabetic, then within the first 5 years of your diagnosis, one should have a ophthalmological checkup. And with any stage of retinopathy, it is up to the discretion of the ophthalmologist to call you at regular intervals. Now, if you are a type 2 diabetes, that is non-insulin dependent diabetes, then the day you are diagnosed with diabetes, probably within those very few days, you should have your ophthalmological checkup, the first checkup of your eye, with a dilated fundus examination, which is known as a fundoscopic examination. If you do not have any diabetic retinopathy, or your eye is not affected, then a yearly checkup would suffice. But if you have any form of diabetic retinopathy, your ophthalmologist would be the best guide to guide you when you should have your ophthalmological checkup next.